All right, thanks, Brett. All right, well, good afternoon, everyone. Thanks for taking time to hop on the update call with us today. Like usual, we'll go ahead and start the call with a review of the numbers or the data, and then talk a little bit about vaccination and some changes into the prioritization grouping that has happened. And then we'll answer questions that people have. So we'll go ahead and start with Jordan and a review of the data. Jordan?
All right. Hi, everyone. Hopefully you're seeing the My Safe Start Excel sheet. So you can see that Mason is in risk level B. Crawford and Lake are in risk level C. Kalkaska, Manistee, Misaki, Oceana, and Wexford are in risk level D, while Mecosta and Newaygo are in risk level E. Our daily cases per million and percent positivity continue to decrease overall for the jurisdiction, and I think this is the first time in a while that we've seen all 10 counties with percent positivity under 10%, which is great. So we reported 59 new cases from Friday at 3:01 p.m. until yesterday at 3. And there were 207 new cases over the past week, with the week before that having 183 cases. So we did see a 13% increase in cases over the past week. Over the past week, cases have been identified as household and community contact, schools, including colleges and daycares, some attending religious services or social gatherings, pre-appointment testing, and some worksite exposures. Our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 11,431. Cases by county as of yesterday are Crawford with 541, Kalkaska 538, Lake 337, Manistee 743, Mason 1,128, Mecosta 1,872, with Ferris reporting 594 cases, Misaki 593, Newaygo 2,600, Oceana 1,770, and Wexford 1,309. In the past week, there were 4 deaths reported and 412 people recovered. Yesterday, there were 4 positive inpatient cases at Munson Healthcare Cadillac, 1 at Munson Grayling, 0 at Munson Manistee, 2 at Spectrum Health Big Rapids, 3 at Spectrum Health Gerber Memorial, and 2 at Spectrum Health Ludington. Now I have to show you the vaccine table. I did add in second doses this week. So as of Sunday, we have given 27,525 vaccines, with 9,744 of those being second dose. And then according to the state dashboard, 46,947 vaccines have been given in our counties, with 15,168 of those being second dose. And the counties are, the state dashboard is according to residents of county. So we've still given about 58% of total vaccines within our counties, if this was perfect. Are there any questions?
Okay, thanks, Jordan.
Thanks.
Okay. One other, just an update to the state dashboard. This actually started on February 10th, but they did, you now can view vaccine doses by age group out there on the state website. So if you're interested in taking a look at where the breakdown is by age group, that is also now available on the state's website. Regarding vaccination, we do continue to move forward with weekly vaccination clinics, both first dose and second dose clinics in our jurisdiction within all of our counties. Again, the priority groups that we are currently vaccinating include those that fall into the 1A group. That's going to be our healthcare workers. It's going to be our long-term care facilities, our AFC homes, And then those that fall into the 1B, Group A and Group B, and that would be our 65 plus population, and then those frontline first responders, and that includes firefighters, police, both state and local, corrections and county jail workers, our child care workers, pre-K through 12 teachers or staff in schools that have direct contact with students. We should just about be done, if not done, with our schools, with our educators. We may have a few more that we're gonna, that still need to get in, but the vast majority of our educators are done with their initial dose of vaccine, or should be just about done with their initial dose of vaccine. We also have adult and child protective service workers, and then our homeless shelter staff. Now, there was an addition, and this information was just released yesterday, that effective March 1st, the state is going to be adding to the 1B Group B category, those food processors and let me find the exact line. It's going to be food processors and agricultural sites. And it's estimated that there are about 80,000 of those workers statewide. That would be March 1st. So we are still awaiting a little more in the way of guidance on what exactly that is going to look like in terms of who is going to be considered to be a food processor and a agricultural site. So again, it doesn't take effect until March 1st. So, we have a little bit of time to plan for that. Also does not look as though we'll be getting any additional vaccine to do that group. So that vaccine will need to come out of our current allotments that we are receiving, which means, we're going to have to kind of be working through the process of getting those new places done. We're not going to be able to take a site and do them all in one day. There's just no way, because we still are required to try to maintain that split of 75% of our vaccine going to the senior population, that's 65 plus, and then 25% going to the rest of those groups. So beginning March 1st, we'll be adding those individuals in, and then working to get through them. There will be some additional logistics involved with that, but we'll move through. And again, as I said, we're awaiting some additional guidance on who exactly is going to fall into that group. We also know that the pharmacy program is now up and running in the state. So there were 3 pharmacy chains in Michigan that are receiving vaccine. This is a federally run program. The state does not have any control over it. That being Rite Aid, Myers, and Cardinal Pharmacy. Cardinal Pharmacy up in the UP. Myers stores in our area, probably the closest one is going to be in Grand Traverse County. And then some of the other stores, Grand Traverse County got a significant, 1,000 doses of vaccine. The other stores, a smaller amount. But Rite Aid, we know their plan was to divvy up vaccine, provide 100 doses to each of 200 stores in the state. And I know I have had communication with their regional person. I know for a fact that they are vaccinating in Fremont at the Rite Aid and at Grant at the Rite Aid. And I believe 1 or 2 of our Myers stores in our jurisdiction also are starting to vaccinate. I did have a conversation with the Rite Aid to assure that their plan was the individuals that they are providing the first dose of vaccine to, that they will also be providing the second dose of vaccine to them. And Rite Aid did assure me that at the time that someone gets scheduled for their initial dose, they're setting them up for their second appointment, the time frame dependent upon whether it's Moderna or Pfizer vaccine. So that was good to hear. I haven't had that conversation yet with Myers, still trying to connect with them on that. The concern being that, and we know we're already hearing, having some individuals contact us who had gotten their second dose or their first dose of vaccine from someplace else and wanting us to provide them with a second dose. We cannot guarantee anyone a second dose if we did not provide you with the first dose of vaccine. The reason for that is we no longer order our second doses of vaccine. The state allocates that based on what they provided us for first doses. So anyone who comes to us requesting a second dose of vaccine, then we did not provide them with their first dose, there's no guarantee that we're going to be able to provide them with that dose. So we are sending them back to wherever they got their initial dose from. You know, if we anticipate we'll probably run into some issues with snowbirds. If that happens, you know, we can put them on a list, and then we'll have to try and see how we can make that happen. But again, you know, we are responsible to guarantee anyone that we provide a first dose to a second dose of vaccine. And so that is our priority, to assure that that is happening. There really isn't any huge increase in vaccine coming into the state at this point. They're still expecting the same amount. So I believe for this week that we're currently in, we had received 975 doses of Pfizer vaccine for first doses, and I believe 1,400 of Moderna for first doses. And then we also received, I think, 1,700 doses of Moderna for second dose clinics that we have. And we may have received some Pfizer. I'm not quite sure. So again, we're still not seeing huge amounts of vaccine coming into the jurisdiction. So working with what we have, setting up our clinics appropriately once we know what our vaccine is. The hope had been that the state would get to a point where, you know, we would have a consistent idea of what our vaccine is going to be, but that still has not yet happened. And a big reason for that not happening is the state is still trying to fix the second dose issue. And you may remember me saying last week that we know that there were some health systems and some health departments that had used doses intended for second doses. They used them as first doses, which threw everything off. And so the state has been having to take doses off the top of the state allocation to make those or provide second doses to the health systems and to the health departments that ran into that issue. So we were hoping that it was going to be taken care of this week. I'm not sure that it is. So we're still kind of waiting to see the impact that will have. An additional order. Okay. That allowed sports to high school sports to continue. Some of those sports, they are required to wear masks. Some of them you can't wear masks, so they are requiring testing, weekly testing of those individuals. All of that is being handled by MDHHS and the Michigan High School Athletic Association. Local public health really has no involvement in any of that, other than maybe to answer a couple questions. So really, those individuals in schools with, you know, they're being directed back to MDHHS with questions that they have on that. We also were notified that CDC has changed, and you probably remember me mentioning this, a change in the quarantine guidance for those individuals that have completed their vaccination series. CDC did change that, and so an individual who has completed their vaccination series and it has been 2 weeks or more since they received their second shot of a 2-shot series, or 2 weeks or more since they've received their initial dose of a 1-dose vaccine, and it's no longer than 3 months, if they are identified as a close contact to an individual, they do not have to quarantine at this time. So, you know, right now it is 3 months. And we believe that 3-month time frame is put out there because that's what we know for sure immunity lasts for. And we also know that we've just started vaccinating, so no one is going to be near the end of that 3-month period. The expectation is that as we move forward and additional data comes in, that 3-month time frame will gradually be extended outward. But as it stands right now, you know, with 2 weeks or more since your completed your series, your vaccination series, up to 3 months. If you're identified as a close contact, you do not have to quarantine. So again, we did anticipate that was going to happen. Another change, this one took effect on Monday. CDC did increase the volume allotment of the Pfizer vaccine. So when we first started, a tray of Pfizer vaccine equaled 975 doses. But pretty consistently, you're able to pull that 6 dose from each vial, so that now a tray of Pfizer vaccine now equates to 1170 in terms of doses that we're able to get out of that vaccine. So I think that is what I have to share. A couple other real quick things. It does appear that the FQHCs will also begin to receive vaccine gradually over the coming weeks so that they can work with the 65 plus population. Talked about the pharmacy program already. And other than that, I think that's all I have. As I said, we do continue to operate our clinics. We had clinics yesterday. We have clinics on Wednesday, clinics on Thursday. Those are all first dose clinics. And then we have second dose clinics that'll be taking place Friday and Saturday in all of our counties. So that is what I have for questions. If there's, or I'm sorry, for information. So questions from anybody?
I've got a couple of them, Kevin. So first one is M. Cameron. Go ahead.
Had a question from our city officials. They're asking with election officials when they would become on to the list or where they would come in. They have a school election coming up, I believe, on May 4th.
Yeah, they are not true. That again is another one of the populations that really is not identified in there. My guess would be they may fall into that 1B Group C or the 1C area. I'd have to go back and really take a look at the guidance to see where that group may fall in. The 1B, that 1B Group C, right now, based on the current MDHHS timeline, is looking at starting vaccination probably April or May. So.
Okay, next question is Janet.
Just want to keep this in front of you guys, and I'm presuming that with the new agricultural workers that the migrant staff, I'm hopeful, will be included in that, because we're going to get to the point after next month where we're going to need the migrant staff to interpret for our non-English speaking people who may work with agricultural producers. And we service, what do we service? Benzie, Manistee, Mason, Lake, Oceana, Wexford, Missaukee. So they have a big territory that they roam around and transport people and interpret for them.
Okay.
I don't see any other hands up. So anybody on the phone that has a question, you can unmute and ask your question.
Hi, this is Brandy Martin with Manistee County CERT team. I heard you're looking for volunteers to work your vaccination clinics. Can you give more clarification on that?
Brett, you want to take that or you want me to?
Yeah, I can. Primarily the push was for what we call support staff. So it's people who might be able to work like parking lot traffic control, or people who are handing out clipboards and forms to clients as they come in, or we have a need to monitor people post-vaccination for 15 minutes, some of them 30 minutes, to make sure they don't have a severe reaction. So there are several what we call support roles or activities that we need staff to function in. And in several of our counties, we're kind of low in terms of health department staff that can do that. So I sent out an email to all 10 of our emergency managers asking them if they could reach out to their folks and see if there are any volunteers who would be able to, or be able and willing to assist at our clinics to fill those roles. So they can be either agency, so, fire personnel or a paramedic, or it could be just a general, church member or school employee. So it's either public or agency is what we call them. So anybody who would be willing to assist us in those roles would be great. And just kind of an FYI, clinics generally run 9 a.m. to 6 p.m. And we have internal and external positions available. So obviously the external people would need to wear appropriate clothing for, standing outside in 15-degree weather. So I don't know, Brandy, do you have any specific other questions related to that?
Yeah, could you fill me in on exactly what you need for Manistee and where the location is and approximately like how many people you're gonna need?
Yeah, I can't give you offhand the actual number that we need per county because it varies by clinic. So for example, we're running 4 or 5 clinics this week. So on Tuesday, it's a different number than what we need on Thursday. So I can't give you exact numbers, but what I told the emergency managers is if they could look at securing 3 or 4 people per clinic date, that would be great. So, kind of work from that number. I mean, if they could get us 1, that's great. But if we could, if the goal would be to come up with a list, so Manistee County has, a clinic on, and I gave these dates. I don't know them off the top of my head, but I gave them to the emergency managers. So let's say that Manistee's running a clinic on, Thursday, Friday, and Saturday. If we could come up with, 2, 4, 8, 12 people that could go on a list that we could call them depending on our need, that would be great. And again, I don't know the location specifically for Manistee either.
Okay. Typically with CERT, I would send out an email to our members and request their assistance and then fill that need with you. So I'm not sure that you want our entire roster of available members to call. So maybe whoever's running the Manistee one, if they could reach out to Jason Torrey or myself, and then we can kind of work that all out, that would be great.
Okay, yeah, I'll see what I can do about who would be the best contact for that. Thanks, Brandy.
Okay.
Okay, other questions? All right, if not, that's what we have for an update for today. We'll plan on reconvening again next week. Next week Tuesday to provide another update. If for some reason we need to pull you guys together before that, we will. We'll share the data we have and our updated vaccination numbers. Any changes that may have come out in terms of epidemic orders or prioritization guidance or anything that we know related to that. If you have questions between now and then, don't hesitate to reach out to either myself or to Brett, and we'll try to get those answered for you. And other than that, one last chance for questions. All right, guys, thanks for taking time to hop on the call with us today. And everybody have a good day and stay safe out there. Thank you.